Common cold versus seasonal flu. What are the differences? Common cold is the top reason of visiting the doctor across the world. There are more than 200 virus types discovered so far, which can make you catch cold. Most well-known of them are rhinoviruses, which are responsible for up to 40% of all cold cases in humans, most often in the early fall and spring. This disease can be easily transmitted by contact with germs, from the nose or mouth via coughing, sneezing, and hand-to-hand contact. The main cure of common cold is the body's immune system itself, and the medications can only reduce the symptoms' intensity during natural healing process. The flu is a contagious disease created by different types of influenza virus. Most flu outbreaks occur during cold months of the year. Some symptoms are like common cold, but with much more intensity, and usually start suddenly then peaking up in just several hours. Influenza virus also can be transmitted easily through air or close contact with infected person. Getting an annual flu vaccine at the beginning of flu season can reduce the chances of being infected, or at least lower the symptoms intensity such as fever or severe body pain. Let's check out the symptoms in both conditions and compare them together. The symptoms of common cold and the flu are much like each other. The only difference is the intensity and lasting time. In common cold, you have a low chance or mild intensity of fever, headache, body pain, fatigue, nausea or vomit, and body shivering. But runny or nose congestion, coughing, and sore throat are very common. In the flu, you have moderate to severe fever, headache, fatigue, body pain, nausea or vomit, and chills or body shivering, in addition to common cold signs. Contrary to the majority people may think so, antibiotics don't work against either colds or the flu. Because these conditions are caused by virus, not bacteria. Most infected people will recover within 2 weeks, without medical treatment or visiting the doctor. During this time they can relieve their annoying symptoms, using home remedies such as OTC medications, drinking plenty of fluids, and getting lots of rest. OTC medications are available in pills, capsules, syrups, or nasal sprays shape, including pain relievers, such as acetaminophen, or non-steroid anti-inflammatory drugs, which can decrease your fever, headache, and body pain. Antihistamines, such as fexofenadine, or diphenhydramine, which are effective to stop runny nose or congestion, and sneezing. Decongestants, like pseudoephedrine, which is suitable when you have moderate to severe nose or sinus congestion. And cough suppressants, like dextromethorphan, that is recommended if you have treatment-resistant coughing. Despite OTC medicines don't need prescription to buy, but there are some important tips you must know before using them. If you are under 18 or over 65 years old, you must visit the doctor before taking any new medication, including OTC. Because some medicines have age restriction. For example, aspirin is not allowed for people under 18, unless the doctor prescribes it. Antibiotics don't have any helpful effect on colds or flu healing process. This class is made to fight infections caused by bacteria, not virus. If you have any special or chronic medical condition, such as pregnancy, breastfeeding, cardiovascular diseases, asthma, diabetes, kidney or liver problems, you must consult with your doctor before adding another medicine to your medical routine. Because unwanted side effects of each medicine can have adverse effect on your current state, besides, your previous medicines can interact with new ones. There are many OTC cold and flu medicines with different brand names, containing a mixture of ingredients to treat multiple symptoms at once. These combined medications may deliver you pain relievers, antihistamines, decongestants, cough suppressants, and expectorants in just one product. While combination medicines are convenient and much easier to use, they may increase the risk of side effects or accidental overdose, especially if you take multiple medications at the same time. To stay safe, check out the ingredients, to avoid doubling up on the same drug before usage. Acetaminophen is in many cold medicines, and exceeding the daily limit could cause serious liver damage. There are several emergency conditions that if you encounter, you must talk to a doctor or go to a medical center soon. Persistent fever. A fever lasting more than 3 days can be a sign of another bacterial infection that should be treated separately. Persistent coughing. When your coughing doesn't go away after 2 or 3 weeks, it could be the sign of bronchitis. Besides, asthma is another cause of persistent coughing. This condition needs to be checked out by a doctor. Painful swallowing. However, sore throat is very common in colds or flu, but severe pain during swallowing may represent strep throat, which is a bacterial infection and needs the doctor attention as well. Vomit or diarrhea. If you have continuous vomit or diarrhea, it's essential to visit a doctor very soon. This condition is rare in adults, but it sometimes occurs in children and teenagers. And finally, shortness of breath or difficulty breathing. This one is another emergency condition, because it can be an alarm for lungs infection. There are some prevention tips too. Wash your hands frequently, especially before eating or preparing food. If not possible, use hand sanitizers instead. Avoid touching your eyes, nose, and mouth until you are sure about your hands being clean. Colds and flu viruses can easily come inside your body through these organs. Use a standard face mask in crowded and enclosed places, like subway stations. Infected people can spread virus by sneezing or coughing. For seasonal flu, vaccines are available in the beginning of flu season, which usually starts on October or November. Flu vaccines are updated every year to match the latest changes of influenza viruses. By vaccination, the chance of being infected decreases significantly. At least if you will be infected, you are going to experience much less intense signs. So if you don't have any special or chronic medical condition, it is highly recommended, and if so, talk to your doctor before. We are so grateful to you for evaluating your health by choosing our video to watch. Don't forget to subscribe our YouTube channel for latest and updated videos. Thank you all, and stay safe.